It's time for a Senior Citizens Forum. Hi, I'm your host, Janice Wood, and I'm here today with Heather Reed of Welcome Health. But a Senior Citizens Forum is still being sponsored by Benefits for You 2 Insurance Services, where we specialize in Medicare Advantage plans, Medicare supplemental plans, and prescription drug plans. And we also do health insurance. So give us a call if you need any help. But today, Heather and we're going to talk about Welcome Health. Is their second year.
Yes.
Yeah. And Heather herself has been in the Medicare industry for several years.
Over 10 years now.
Over 10 years?
Yeah.
So she's been an insurance agent like myself.
Not as long as you, not as seasoned as you in Medicare, but yes.
Yes, in Medicare. And she loves working with senior citizens. Welcome Health takes, I love the way they always say, we take the old-fashioned idea
of a doctor coming to your home.
Yes, and the doctor comes to the home instead of that, like a Marcus Willoughby, if everybody out there knows who that is, they know they're a senior citizen, okay, would come to the house with his bag, but they come to their house with their backpack, which includes their computer, their laptop.
And it's all about just having the convenience of the doctor coming and the old school mentality that we're all missing from back in the day.
Yeah, and Welcome Health is growing, so which is really important, and it's exciting. So one of the things I wanted to ask you about with Welcome Health, you go to seniors who are 65 and above, okay?
So the only qualification for our practice is 65 and older and contracted insurance. As long as you live at a private residence, independent living, mobile home, or senior apartment, we're able to come to you.
That is to me, that's really great because we're sitting here in the Southern California area where we're having a major storm.
Which is very unusual for us.
But is unusual for us, but not for Heather and I.
We're always together in the rain.
Always, always, okay. I think we create something for the rain, okay?
Which is much needed, so it's okay.
Right, okay. We do need the water, okay, because we will go back into drought. But Welcome Health works with specialists. How do you assign a specialist to someone? And do they have to go to the specialist or the specialist go to them? How does that work?
So every patient is different. So it depends on their circumstance, what's going on with them. But all of our doctors are internal med or geriatricians and have been in the hospital setting, so they could take on more than an average family practitioner. But when they do see that there is a need for a specialist, we can use a consultation through our physician, which is digital. Our doctors are able to correspond with a specialist, like a dermatologist, for example. If there's a rash that's not being treated immediately, we can send photos, and that doctor can consult right back and forth with our primary care physician. It's a faster turnaround than waiting for a referral from your health plan, for example, than waiting for an appointment with your specialist. If you need to go to a specialist in person, depending on your insurance, our doctor writes the referral and then keeps you in network. From there, it depends where that specialist is, but you have to wait for an appointment at that specialist office, which is the most challenging.
Right, and one of the good things about some of the Medicare Advantage plans is that they will provide transportation to and from the doctor's office, which is really good to know, okay? Because I know a lot of seniors who have Medicare Advantage plans aren't using that transportation.
And it's scary just to navigate where to go at some of these doctors' offices. So we try to streamline how many specialists our patients are seeing. We know the challenge of going to and from, price of gas. But yes, please use those transportation benefits if you do have it.
Right. And they will also, that transportation will, if you need x-rays done.
So if there's any additional services that you do need, you can use your transportation benefit when it becomes medical necessity. But we at Welcome Health, if our doctors see that you need lab work, for example, routine blood panel, we can have that done in your home if it's ordered by our physician, if you're having a hard time getting around. But it's about listening. So if you'd like to go do those activities because it's close to the grocery store, or you have family that's able to take you, or you are still driving yourself, you're more than welcome to go do those activities. Same thing with x-rays as well.
So Welcome Health does help them out. But one of the things that we're talking about, I'd like to talk about, is selecting a medical group. So what is a good way to select a medical group? Because things keep changing. And the second half of this show, we're going to talk about primary care doctors, but medical groups. Now, if I wanted to select, say, Welcome Health, and I was comparing it to another medical group, what should I be looking for?
So the major difference for Welcome Health is that we're mobile. So that makes us stand out right away, that we're coming to you. But most importantly, you need to identify what medical group has urgent cares close to your home, what hospitals are you associated with, and what clinic that your doctor that you'd be going to regularly is close by. You don't want to be going to a doctor that's 50 miles away because you're a medical group. You want it to be close by and has all the specialist network that you need if you have a chronic illness.
Yeah, because I know one of the things that we were talking about before we started this today was that I travel to go to the doctor, okay, because I want to see specific doctors. And it's important to know if you're having an emergency and you call 911, they're going to take you to the closest hospital. It doesn't matter what medical group you're part of or what hospital you would rather be at or what doctor is associated with the hospital. They're going to take you to the closest hospital. And that's real important to know.
And that's essential because the one thing is you don't want to be thinking when you're having an issue that I have to go to a certain hospital. It's up to the paramedics or whoever the emergency transportation that arrives to see you. They are taking you to the next level of care that you need.
Right, because you can be going what they call out of network.
Especially if you're traveling, if you're
Right.
visiting grandkids, especially if you're out of the area. That's very important that your medical group is your necessity for your day-to-day needs medically, but if an emergency arises, it's there for you when you need it.
All right. So basically what we're talking about, if you're in your home area, within your network, so you're a member of a medical group that doesn't go to the hospital that's the closest to you, you're still going to be going to that closest hospital in an emergency.
And it's important to be with a medical group that meets all of your needs and is truly going to listen. Are they going to share your records when it's needed? How much staff do they have? Do they have availability for appointments if your primary care physician is full? What urgent care is close by that's able to meet your needs in case that there is a changing condition with you? So that maybe an emergency room is not appropriate, that you have access to care when needed. But keep in mind there are some virtual care that you do have access with your health plan. But think about a medical group. Do they have that program already built in? Do they have a urgent care or crisis moment open 24 hours? Is it a physician answering the phone? Is it a nurse? What's important to you?
Okay, so when you're talking about a nurse, are you talking about a nurse practitioner?
It could be a nurse practitioner, an RN, but primarily a nurse would be an LVN or an RN, but a provider could be under the term physician assistant, nurse practitioner, or physician.
Because I know my stepdaughter, she works at a clinic and she's a nurse practitioner, and so she's
a little bit above of an average nurse because
Right.
she's able to write prescriptions quickly. But it's just sometimes it gives you peace of mind, especially if you have a heart condition or diabetes, that you have a quick response to a question, or if you're not feeling too well, get that medical attention addressed.
Yes, and I know some people would rather deal with a nurse versus an MD or a DO.
Everyone's different, so
Yeah.
it's important to ask who in that office, if we go into the provider side, or just the medical group, what is the overall clinical staff that's offered?
Very important to know. So when you go to the doctor's office and all of a sudden they say, you need to go to the emergency room, you want to know, is that emergency room 50 miles away, or is that emergency room within a close proximity?
Here in Orange County and LA County, we're very lucky to have hospitals in a very close radius. But if you are more remote, you need to have that in consideration.
Yeah. Okay, but if you are out of your network area, which she and I do all the time, we go out of our network areas. We like to travel, okay? And I got sick. They're going to take me to the closest hospital. So when you do travel, let me go back real quickly. So when you travel, make sure you have your medical information with you, along with your medications, okay? Because it's real important you have that, so that emergency room can access what your medical records are. And especially nowadays, when working with a medical group, you want to make sure that they have online.
Yeah, that's one thing to ask, because they're able to transfer your clinical records for that physician overseeing your care at that time.
Right.
But it is essential to basically have a small piece of paper in your wallet, for example, with all of your medications, or have it attached to your insurance card so it's always together. And keep in mind, your medications may change. So as soon as that change is done, right after that doctor's visit, make sure it's updated before you leave. And also, if you have any allergies, please make sure that that's notated there as well, especially if you need an EpiPen, for example. It makes a huge difference when you go to the emergency room.
I'm so glad you said that, okay? Because I have allergies to bee stings, and I'm going to be going very shortly in an area where they have bees. I got to go get an EpiPen.
Yeah, it's very important, especially if you're in a remote area where you don't have access to that stuff.
So remember, when you're traveling, to make sure you have the information that's needed in case you have an emergency. Nobody thinks they're going to have an emergency when they travel, but it happens, because I know personally, probably about 15 years, well, not 15, about 12 years ago, I was traveling, and I was at a family function, and then he was my significant other, now my husband. He got really sick, and he had to go to the emergency room, and he ended up having to have an operation.
Oh, goodness.
But everything was covered by his insurance because it was an emergency. So if you're having an emergency, you can't go in for your normal every quarterly blood test that some people have, but you can go in and have blood tests if you're having an emergency, because those blood tests are tell so much about you.
So I actually had a family member recently that was in South America, came down with laryngitis and bronchitis, and needed to go to the emergency room to get antibiotics, and brought their insurance card, but because they were in international waters, they didn't know what that insurance covered, so they asked for an itemized receipt, got all the services that they needed at the hospital, came back to the U.S., showed those receipts to their health plan, and was reimbursed completely. So sometimes it's important to have that conversation with Janice, for example. If you like to travel, and what's the difference when you're on a cruise, if you're covered or not? All those things make a factor, but being overly prepared is the best thing. Having your insurance card with your medication list, and if you do have a DNR, that it's mentioned there, and you're good to go.
Right. One of the things I always recommend to my clients is that if you know you're going to be traveling, especially foreign travel, outside of the United States or even within the United States, call the insurance company, tell them that you're traveling, and they will tell you what you need to do if you get sick. I have one carrier that will send out a list of what happens if you get sick in another country and what you need to do, and you're aware of happening. Now, Heather just mentioned, what if you're on a cruise, okay? A lot of the cruises, and you need to check, have coverage for you that goes beyond what the insurance, health insurance will cover. Because health insurance is only going to cover your medical needs. It's not going to cover the change of air flights or train flights, whatever it is that you're traveling on, okay? It's not going to cover if there's civil unrest, okay? It's not going to cover you if you have to stay in a hotel. It's not going to cover any of that. So yes, you may have the medical coverage, but check with whoever if you're going on a tour, make sure you know what coverage they provide you as part of that tour. Because I know I was on a cruise and we were in France and we were going up all these different church steps, you know, the cathedrals and stuff.
That you're
and
not
one of the gentlemen,
even at all.
it was raining, okay, and one of the gentlemen slipped and cracked open his head.
Oh, goodness.
So it was like, I don't know what happened to him because he wasn't part of the group that I was in, but I know the cruise line that we were on, they provided his wife with transportation, a place to live while this was all going on.
Wow.
And I don't know what his medical was. I'm assuming by age he has some form of Medicare coverage. But if one of the things that's very tricky, if you just have straight, what we call original Medicare, it will not cover you outside of the United States. So that's important to know.
It really is, because it gives you that peace of mind knowing that your insurance is going to cover you, so you can make that decision to go on those travels. But if it's not, you need to talk about getting supportive insurance that can cover you medically outside the U.S. because Medicare does not leave the U.S.
And there are such things as travel insurance.
And they can be quite costly. So that if that's important to you to travel, consider that when you're making your selection for your health plan or a Medicare Advantage plan.
Yeah, because I know I've had 2 clients over the years. One had Medicare insurance with the Medicare Advantage plan, and her plan paid for everything when she was traveling. She had a stroke. I have another client who became my client. All she had was original Medicare. Mm-hmm. She went into Canada. Canada does not recognize Medicare as a credible insurance, neither do the other countries, okay? And she had a stroke. It took her almost 3 years to get back to some kind of normal, because she was paralyzed. It was terrible, because there's a shot that they can give you within the first 6 hours. Because they didn't recognize the insurance as being credible, they took people in according to what their importance were. So it's really sad. So it's important to know if you have Medicare insurance or you have regular insurance, what it's going to cover outside of the United States.
Because usually when you're over-prepared, something doesn't happen, but when you're under-prepared, that's when an emergency usually arises.
Yeah.
And it gives you peace of mind to actually enjoy your vacation, that you have all the credible coverage that you need if something were to happen. And also make sure that if you're traveling with a companion, that they're aware as well where to access your information.
All right. And you should be aware of your companion's needs also. So don't forget your companion who you travel with, because they also can get sick.
It's true.
Yeah. Okay. We're going to take a real quick break. We'll be back with Heather, and this is a Senior Citizens Forum, and we're going to be back and we're going to discuss What happens if you find you need to find a new primary care doctor?
Here at Benefits for You 2 Insurance Services, we believe knowledge is power when it comes to selecting the correct healthcare and Medicare insurance. Please contact us at healthcareoptions@benefitsforyou2.com or call us at 310-245-0332.
Hi, welcome back to a Senior Citizens Forum. I'm Janice Wood, your host, and I'm back here with Heather Reed from Welcome Health, and we talked a lot about, Welcome Health as a medical group at the beginning of our program, and how they come to you. You have to be 65 and above to use them. And we also talked about if you're doing traveling in your emergency, which is real important to get information on if you're doing any form of traveling. But right now, I know, Heather, doctors are moving around.
Yeah,
Medical groups are changing.
Especially since COVID, changing clinics, changing medical groups, because their contracts change frequently. So it's important to keep in touch with your doctor's office to make sure that your physician is still there.
Or is your physician still taking your insurance? That's another one.
Yeah, so some people only have to go once a year for your annual physical, which is great. But make sure that you just keep in touch for any reason if they change insurances.
Yeah, because one of the things that I personally am experiencing right now is that all of a sudden my insurance company is saying that my medical group is out of network.
Oh, goodness.
Okay, this is like, I got my first notice of it in January, and I'm going, you're just telling me now? Okay.
Well, good thing there's open enrollment period so that you know that you can make
right, but there are some changes that can be made within your insurance, but this is happening more regularly than not, okay?
It's unfortunate sometimes the contracts don't align when annual enrollment happens or open enrollment, but know that if you are with a Medicare Advantage HMO, you can make a change with the medical group monthly if there is a need. So keep in touch with your doctor's office. So if your primary care physician changes to a different medical group, that you have that option as long as they're contract with your health plan to change medical group by the first of the following month.
Right, and if you find out that your medical group is no longer taking your insurance, a lot of doctors are a member of more than one medical group. So you want to call your primary care doctor's office up and say, okay, you're no longer going to be taking XYZ insurance, maybe Orange Insurance Company is going to take my medical group or one medical group over the other, if that makes any sense, okay? But there are some options, but sometimes they're not an option. I've heard so many times, especially over this last AEP, well, my doctor's retiring. My doctor is moving. My doctor is changing medical groups, okay?
And it can be quite stressful if you've been with that physician for years to all of a sudden have to think, how am I going to keep this physician? Or if they are retiring, being proactive and getting a doctor that's going to meet your needs before that individual does retire, and before you have a change in condition or need to have a referral reauthorized, to be in charge of your own health and identify a new physician that's best for your needs.
Okay. Or the other story I've been hearing is, well, the medical group assigned me a new doctor. I don't like that doctor.
That is very common, especially at the beginning of the new year.
Right. Okay. All of these come up. So what am I going to be looking for in a new doctor? Okay. There's so many different types of doctors out there. There's internists. There's family practice. There's geriatrics. You have primary care doctors that specialize in specific things, okay?
So it's important to think of yourself only. And I know that could be hard for a lot of people, but your needs are going to be different than our needs.
Right.
So, and this happens a lot with spouses. You don't both have to have the same doctor. So it's essential to really think about proximity. Where are you residing? Is your primary care physician important to you to be very close by? What is their availability of appointments? So you can openly either stop by and just check it out, or call their office directly and say, how many availability do you have for urgent care matters, or someone's been hospitalized? What does your routine follow-up visits look like? Additionally, how many patients do you plan to have on your census before you're capped? Little things like that can really help you make a change. But it's going to change in the factor of, are you 65 and older? Do you have a chronic illness? Do you feel that you need to be with a geriatrician? It's important to have those conversations to yourself, your family members, but also you can talk to a case manager at a hospital if you're a frequent or been recently hospitalized, or a senior center. You can talk to people, have open conversations. There's a lot of resources online too for you to review your physicians as well. But make sure that if you want to stay in a certain medical group, that's your first point, is you want to stay in that particular medical group because of the urgent care, because of the hospitals, because of the specialist network. That is going to narrow down what primary care physicians you have in network to select from. But you don't have to just go with what the health plan assigned you. You can be your own advocate and identify another doctor that's going to meet those needs.
I got this. Lauren?
Yes.
I'm hearing Leon really loud and clear. And if I'm hearing him, I know the microphone is.
Well, because you have the microphone, it's probably not the microphone.
Okay, but that's
you. But we'll close this.
I'm going, oh my goodness, this happened. You and I always have crazy stuff. Okay. Thank you. Normally I don't hear him. Okay. All right.
One thing.
Wait.
Sorry.
Got to start it. Okay.
One thing to consider as well is to ask the doctor's office, does the primary care physician have multiple locations that they're visiting? So that you know if, Dr. Nguyen is Monday and Tuesday only in Los Alamitos, and Thursday and Friday are in LA County. Is that going to be convenient for you? Knowing that doctor travels, which is nice and convenient knowing that they go to different locations. But that may be something that may put a red flag for you to consider, that doctor is not there Monday through Friday. So availability of appointment to your local area will be a little bit more slim. So do your research and identifying what's going to meet your needs, because I can't say that enough, that your neighbor is going to be different, but they can be a great advocate for you, especially if you are new to the area, and identifying some new resources.
One of the things I wanted to talk about, there's a couple things that you mentioned, but one of them you talked about is going online. It is so easy to go online and research a doctor. And I'm always telling my clients, I said, if I'm there, I'll do the research with them, okay? I will show them how to research. You can go into the medical group and see what doctors are available. I always go one step further. I'll pick 3 or 4 doctors that I may be interested in that medical group, and then I will go just Google their names and see what comments people make about them. A doctor is just like a friend. What works for one person may not work for another. I have actually they're friends and they're also my clients, husband and wife and his sister. All 3 of them were going to see the same doctor. The sister and the wife thought the doctor was horrible.
Oh,
he thinks he's the greatest thing that ever lived. Okay? And I'm going, I just sit and listen to them because it's a comedy act. Okay? All right. And so the wife and the sister, they went and found their own doctor, and they tried to talk him into finding another doctor. Nope, I'm staying with my doctor. Okay.
So a good point that you're going off of, Janice, is that being an independent broker like you are, you're talking to a lot of seniors.
Yeah.
And close to your proximity of where you're providing care. You may be a great resource in knowing what physicians you're hearing your clients say, genuinely, I get my appointments, I have great outcomes, I like the office staff, I'm getting that communication line, they're answering the phone, which is a big thing. So there's so many different resources to your disposal.
The office staff is a major issue. I've heard people say, I love the doctor, but their staff is terrible. Well, you have the right to make a complaint.
A lot of times, if you don't say something, they don't know.
Yeah.
And also to take your point, Janice, if you're looking online for reviews, take it with a grain of salt. There could have just been one instance that may have been miscommunicated and someone is venting. So it's like if you're on Yelp and you go through to a hotel or a restaurant and you're writing a review, read the content and know that it may not be that urgent and maybe it's already been addressed of that situation, but see if the office is actually responding to those comments as well, because then that lets you know that they're reading their reviews.
Yeah, and it's important if you don't like sitting and waiting for a doctor for 45 minutes. That's important when you're choosing a doctor. Find out if there are wait times. I mean, I know right now where I go, if I show up 15 minutes early, they usually take me a few minutes early, and I'm in and out. Does your doctor listen to you? If you go in and you feel like the doctor is not listening to you. I hear that complaint all the time. My doctor doesn't listen to me. She doesn't hear, or he doesn't hear what I have to say.
That is really important as a patient. You need to have that relationship with your doctor that you are going back and forth and sharing what you're feeling, what are the emotions that you're dealing with on a daily basis. Some doctors are not addressing anxiety or depression like they should. You should be able to have those intimate conversations and not having a physician just look at a computer. Have them actually, you want to make sure social is a big thing. That's one thing Welcome Health is so convenient, is that when you're in your home space, your heart rate is at a better rate. You're not worrying sitting in a lobby. You don't know who you're sitting next to and being exposed to. So you're most likely to be taken off some blood pressure medication, because I don't know about you, Janice, but when I go to the doctor myself and I work with doctors, I get uneasy and my heart rate goes up. So little things like that is a big thing, but also addressing fall risk within your home. Actually being able, if you're diabetic, to show if you're able to maintain your blood sugar checks. Some people have tremors, and when you're quickly at a doctor's office, when you're only with them for about 15 minutes, you may actually have a tremor just because you're nervous of being there, or they don't have time to address how to teach you to use those medical equipment. Also, if it's really important to you to only be seen by a physician, a doctor, that you identify that with your medical group. Welcome Health, we're transparent that we do have nurse practitioners and physician assistants to help our doctors for urgent care matters, help with follow-ups with our chronically ill patients, but our practice is physician forward.
It's so important. And you do have the right to change doctors. As Heather said, if you're in a Medicare Advantage plan, you can change on a monthly basis. I don't recommend that. You should at least give a physician some time to adjust, okay? One of the other things that I'm always hearing, okay, when it comes to HMOs versus a PPO, okay, is, oh, if I have a PPO, I'm going to get seen by a specialist quicker. I've been finding the opposite has been true.
So sometimes when you're with a PPO, you think you can go to any specialist and that you're in need of it. when you have an HMO, your primary care physician is your gatekeeper. They are really looking at all of your medical needs. They have your lab work, they've actually done a physical with you, they have imaging to look at to really know if you really need to go see a specialist. A lot of patients are going unnecessarily and it's stressful. But if you do need to go to a specialist, your primary care physician can write the order and saying if it's stat, is there a lab work or imaging that is alarming that could be that needs to be addressed immediately? Those doctors' offices can go the extra mile in calling with a medical assistant or a staff member and calling that specialist group and letting them know we really need this patient to be seen. But when you're at the PPO, you're just another patient, and it depends on availability. And we do have a shortage with specialists. Everyone is going to their doctors now since COVID.
Yeah.
And you have to keep in mind, some of these specialists are not just seeing someone 65 and older. They can be seeing all age ranges, so that's one thing to consider when you are selecting other specialty groups, that it may be hard to get some appointments.
Yeah. Well, one of the things I found with the PPO is that you don't necessarily get to see a specialist sooner, because lots of times that referral that comes from the doctor's office will go faster. Because the
Especially if they can
PPO was
advocate for you.
also a network of doctors, okay? So just because you have a PPO does not really mean you can go anywhere you want to go. It means that they have a contract with a network of doctors. But I've been finding I get phone calls from clients saying, well, the insurance company has turned it down, and then go back and find out that the referral never went from the primary care doctor's office.
So that's important to ask, is what the process is for referral, what staff are helping the doctor get those orders processed quickly. Do they have case management that are helping address certain needs as well? What additional services does that medical group or primary care physician office offer? One thing about Welcome Health is that we know that there's a social need as well for our patients, especially that those that live alone, or it may be hard to leave the home, or financially it's a burden. So we do have a community health worker that's able to help address medical paperwork needs, help you get in connected with a nonprofit that maybe can help you with food insecurity. So there's a little bit that can go an extra mile if you ask or just pay attention to extra services that are offered by that group.
Yeah, so it's real important, like Welcome Health, all the other medical groups have some form of a social worker type person in them.
Not all though. That's one thing to ask.
Yeah, but your bigger groups usually do. If you are a member of a bigger group, look to see if there is somebody within there. I know I had an experience where I had to go to someone like that, and I spoke to my primary care doctor. She goes, I have the perfect person for you to talk to.
And some of the terminology of titling could be a navigator, coordinator, case manager, social worker. Those are kind of the typical titles that those individuals have. So if they do give you a call, they're really could be helping you identify something that you may never know that you can benefit from.
You never know. You never know when you're going to need that extra little help, and your primary care doctor themselves can get that taken care of. So when you're choosing a primary care doctor, remember, I could help you out if you want. So you just give us a call, or you can go online and research within your medical group, and then I would go through and go outside the medical group with the doctor's names and look to see what's there. I recommend sometimes, you may want to talk to a friend, but make sure that if you're looking for a specific doctor that has specific experience, like some internists specialize in diabetes, some internists specialize in cardiovascular problems or kidney problems. They do more than just what a primary care doctor does. or there are actually, for people that are 65 and older, there are geriatrics doctors. And that's what Welcome Health works a lot with, geriatrics doctors, okay? That work specifically with the seniors. I know I don't like the word geriatrics, but there's no word that's good for saying that you're getting older, okay?
Well, we understand the process of aging, which
Yeah.
is a term that I would rather use personally.
The process of aging,
but
yeah.
professionally and medically, we are focused on geriatrics. But
Right.
we understand that that word can be a little bit stigmatized for a lot of people.
Right.
But it's important to identify when we are 65 or older, our bodies are different as we age. So it's important to have a physician that's able to address those changes.
Because you don't want to go to an internist that specializes in pediatrics. That's not where we belong anymore, okay? We would like to be that young again, maybe.
That would be nice.
Maybe would be nice. But we all age, okay? So it's important to do research on your medical groups, do research on your primary care, and we've just given a lot of really good information to help people out. So if you have any questions, information on how to get a hold of us is posted here. Please contact us. Either Heather or I would love to talk with you. If you don't have a medical group like Welcome Health in your area, maybe you will at some point, okay?
It's best just to keep asking frequently. Your best advocate for that would be a local senior center would know, or possibly the hospital where they're referring most of their patients to that are homebound or are just having a hard time financially leaving the home. So be willing to ask. There's nothing wrong with that, and always know that there's ever evolving in our medical field and when it comes to access to care in the home.
It's very important. Well, Heather, this has always been fun.
Well, thank you, Janice, for doing this program. It's wonderful that you're taking the time out of your busy schedule and being an advocate for others.
I know, we love doing this. We love providing information to people who are out there, to seniors and their families. I never want to exclude their families or friends that may need to be helping that senior that's out there.
Yeah, and if you are a caregiver that's watching this, know that you're not alone. There's a bunch of resources out there. So give us a call, and that's going to be at the end of this presentation. So please don't hesitate to reach out.
Okay. All right. Thank you again for coming on. I always love it. We always have a lot to talk about. Everybody out there, have a great day, and we will see you at our next session. Bye.
Bye.